They're not getting better. And one of the things that if we have time for this, a question that I have is, I have to pay for my own insurance, so obviously, you know, I have a vested interest in this. But folks who get health insurance through their employer also have a very vested interest in what happens. A friend of mine who's employed gets health care through her employer. My husband and I pay about $700 together for our health insurance. Her agency is paying over $700 a month for just her, not even for the rest of her family. So that's money that schools, that public agencies are having to pay to these insurance companies to cover their employees. That's money that can't be spent on other things in your budget.
Well, that's a really good point, yeah. And along those lines, I think it was maybe last month, Obama was at some kind of town hall, and a woman stood up and said, hey, you know, it's like, you know, Baucus and these other people, they are getting a lot of money from the pharmaceutical industry. Isn't that a conflict of interest? And Obama totally did not answer the question. And instead what he said was, well, you know, the power of employer-based health insurance is really important, you know. And what I would have said at the time was, well, people are losing their jobs, you know. Even if I have employer-based insurance, what do I do if I lose my income and I lose my insurance? What am I going to do then? You know, for me, I guess this issue becomes even more important. One of the reasons that I've come to New York, as you know, is a friend of mine has come down with cancer, and she is battling. She is doing chemo. She's doing radiation.
Surgery, acupuncture, everything. Yeah,
and you know, I'm going to her house. I'm visiting her during the day, and every day she gets a stack of letters this big, and the woman is 32, you know. She gets a stack of bills this big, every day, and, you know, weird copay things she has to figure out, and the woman can barely, you know, focus. She's got 2 small kids. She's trying to get through this disease, and somehow now she's supposed to deal with, you know, 1,000 insurance companies that say, no, I won't pay for this, I'll pay for that. And so the system obviously is dysfunctional.
It is.
You know, and there are things that we can do, you know, about it. I think the bottom line is if we can open up and look at what is working for other countries. I would say, just again in summary, putting things on electronic billing, you know, having a single payer to get rid of this middleman insurance company stuff, you know, more emphasis on preventive care and how people can empower themselves. Now, the only bill that I see going through Congress right now that is kind of similar is that from John Conyers. It's H.R. 676. Now, of course, Baucus and Grassley have said, oh, no, 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 this is impossible. We can't do this at this time. In fact, Obama has said the same thing. But I would encourage people to learn more about H.R. 676, learn what they like, what they don't like, and then start writing letters to the editor, contact their Congress people and say, hey, I'm taking this issue personally and I expect you to do something about it.
Right. One of the things that when you're doing that advocacy work, that a letter from a constituent counts as at least 10 votes in a community. And so those letters are very critical.
Oh, that's really, really interesting. Wow. So who would you suggest that people in New York contact with letters?
Well, I think contacting the press is important. Even if your letter doesn't get listed in letters to the editor, enough letters will prompt a newspaper or a television statement to do another story from another angle on this and maybe delve into it deeper. Absolutely, you have to contact your representatives. You have to. So state representatives, federal representatives, senators, governors. Another thing, governors have a lot of sway in what happens in Washington, D.C. And I also go to whitehouse.gov, and I write letters online to Obama all the time.
You do?
And you can pick the category that you're interested in, and you can write as long of a letter as you want. And I'm hoping that, you know, at least someone's putting those together and he's getting the information. That's how it's supposed to work. And that's what happens. Staff takes those letters and pulls out the points and puts them into a briefing document for the representative. So, you know, they're hearing every day, and with gifts and with money from pharmaceutical companies.
That's right.
And from medical insurance. And they've got to at least hear from us.
That's a really good point, because they're getting information from the other side, if you could call it that, all the time. And so we need to do is to raise our voices. For me, it's kind of interesting because in the case of, for example, when somebody is sick, what's very important is to help empower that person to, take control of their lives in order to get healthy again. For me, our healthcare system is sick. So what we need to do is to help empower people to take control of the system and not just look back and think, oh, well, I hope that, the politicians up there will make it better, because they won't,